This video has been commissioned by the Ministry of Health and Social Services for educational and informational purposes only. The individuals and images depicted are for demonstrative purposes only and may not be construed as indicative or representative of real patients affected by any illnesses described, depicted, or otherwise alluded to in this video. The video has made use of actors for demonstrative purposes. The statements made in this video may not be construed as medical advice. The information is not intended to replace medical advice offered by physicians. How much do we know about the institution responsible for the overall health and welfare of every single member of our society?
That's what we're dreaming of. We're dreaming of a sector that is well resourced in terms of human resources, that we have all the doctors that we need, all the pharmacists, all the nurses, and we have all the equipments that are required for taking care of anyone. So that's really our dream in the long term.
The mandate of the Ministry of Health and Social Services, MOHSS, is derived from Article 95 of the Namibian Constitution, which emphasizes the adoption of policies and the enactment of legislations to ensure the health and strength of Namibians. Drawing from the supreme law of the country, the ministry's mandate is to provide and protect the health of the Namibian people and provide quality social services to all, especially the weak and vulnerable members of society. Among the functions of the Ministry of Health and Social Services are to create an enabling environment to provide quality healthcare and social services for the attainment of the national policies, legislations, and development plans of our country, including Vision 2030 and the Harambee Prosperity Plan. The ministry continuously develops the capacity required for health planning and social services and maintains a database of the information necessary for making policy decisions. The strategic functions of the Ministry of Health and Social Services are the policy, legal and regulatory framework, public health, hospital and clinical services, standard setting and quality assurance, health infrastructure development, research and development, emergency response, health and social service planning, human resources for health, social welfare services, pharmaceutical services and supply chain management, diagnostic services, the management and administration of health resources, development cooperation for health, and environmental health and biosafety. Our work in the fulfilling of our constitutional duty is underpinned by the commitment of our leadership, management, and staff to our grand and noble vision to be a leading public health provider that ensures a long and healthy life for all Namibians. To achieve this, we endeavor to implement our mission to continuously improve the health status of Namibians by providing integrated quality and accessible health services. We at the Ministry of Health and Social Services are fully committed to living our core values every day. These values are professionalism. We conduct ourselves according to the ethics of our professions and abide by the set code of conduct for specific professions. Confidentiality. We do not divulge personal or professional information to a third party without consent. We keep our patient information confidential and use it only for the purpose of treatment, unless legally obligated to do otherwise. Caring. We strive to treat others as one would expect to be treated and provide care and support to clients as though they are members of our own families. Integrity. As ministry employees, we are truthful to ourselves and to the public and show steadfast adherence to a strict moral and ethical code of conduct. Accountability. We maintain loyalty and responsibility to the patients, colleagues, the workplace, and the ministry.
Hi, my name is Nesta Kapofi. I'm a medical scientist, medical virologist at Namibia Institute of Pathology, and we are from the Department of Molecular Diagnostics Unit, where we test for viral loads and HIV DNA PCR. And the reason why I'm here is to offer services, medical laboratory services, to the Ministry of Health, and not only the Ministry of Health, and also to the public and private doctors at large.
Today my name is Roxanne Furi. I'm a medical technologist. I work at Namibia Institute of Pathology. I chose this field because I enjoy helping patients and doctors achieve the best clinical outcome for their patients.
I am registered nurse Raunanda Tewapo. I'm giving nursing care to the cancer patients in radiation oncology. Those who are going to the machine and those who are going to the doctors.
I'm taking care of those ones who are going to the radiotherapy machine, and I love my job. I love taking care of sick people. I love my people.
For me, there is nothing more convincing and making you feel happy than seeing, for example, a patient coming in very sick in a wheelchair. You give the treatment, and after a week or two, that patient stands up and start working and feeling better.
We are talking about treatment that it's all-inclusive. We are looking at the psychological aspect of the person, we are looking at the social aspect of the person, and we are going to look on the physical aspect of the person. Now, that it's actually what I am passionate about, and to see that the nation of Namibia is healthy.
The Ministry of Health and Social Services is managed by a competent and dedicated leadership team, headed by the Minister with the support of the Deputy Minister, Permanent Secretary, and Deputy Permanent Secretaries.
We're really imagining ourselves as being a reliable, trusted, competitive sector in the Namibian environment. What do I mean by that? We want people to regain confidence in our sector. We want a reliable and quality, affordable public healthcare services provided by the ministry.
I want to go out in this ministry seeing that every nurse feels so comfortable to come to work. Every nurse sees the patient in one eye, not according to our social classes, according to our status and other things. So that is my first objective.
We have learned that it's always good to do more with less. Even though if the budget is not sufficient, we are confident that we will be providing the infrastructure, building of clinics, hospitals, so that we can take the health to the people.
At a national level, the Ministry of Health and Social Services is composed of 3 main departments under the Office of the Permanent Secretary. Each department is run by a Deputy Permanent Secretary. The 3 key departments are the Department of Policy Development and Resource Management, the Department of Health and Social Welfare Policy, and the Department of Regional Health and Social Welfare Services. Under each department are various directorates responsible for overseeing a number of important healthcare programs. Each directorate is run by a director. The directorates at a national level encompass the policymakers responsible for setting up the standards, guidelines, and quality assurance for the Ministry of Health and Social Services and providing support to head office, and the regions by mobilizing and allocating resources for all the activities required to fulfill the ministry's mandate. Directorates falling under the Department of Policy Development and Resource Management include the Directorate Human Resource Management and General Services, the Directorate Policy, Planning and Human Resource Development, and the Directorate Finance and Logistics. 5 directorates fall under the Department of Health and Social Welfare Policy. These are the Directorate of Tertiary Health Care and Clinical Support Services, the Directorate of Social Welfare Services, the Directorate of Primary Healthcare Services, the Directorate of HIV/AIDS and Special Disease Programs, and the Directorate of Atomic Energy and National Radiation Protection Regulator. The Department of Regional Health and Social Welfare Services supports and oversees the operations of all the regional directorates across the country in collaboration with the Department of Health and Social Welfare Policy and the Department of Policy Development and Resource Management. The Department of Regional Health and Social Welfare Services is an expanded directorate that includes all the disciplines required to support the operations on a regional level. In this regard, the regional directorates also host their own human resource, finance, and administration capabilities, which are supported by the relevant directorates on the national level. In this regard, the Ministry of Health and Social Services has regional health directorates located in all 14 regions of Namibia, namely the Karas, Hardap, Khomas, Omaheke, Oshodonjupa, Zambezi, Kavango East and West, Ohangwena, Oshikoto, Oshana, Omusati, Kunene, and the Irongo regions. Within these regions, the Ministry of Health and Social Services also operates 35 health district offices in Namibia, falling under each regional health directorate. The district offices are the geographical health clusters of the communities and the coordinating body for the services the ministry offers. The majority of regions have approximately 3 districts. However, some regions may have more or less districts depending on the size, population, and the level of the development of the region. Each district hosts a district hospital. For example, Katima Mulilo is a district under the Zambezi Regional Directorate. As such, Katima Mulilo's hospital, healthcare centers, and clinics all fall under the Katima Mulilo district. District hospitals are run by district health management teams or district coordinating committees, who also offer small-scale primary healthcare services, clinics, and health centers to the various communities they serve. In terms of staffing, each district has a senior medical officer who is in charge of the district hospital. He or she is also called the District Coordinating Committee or DCC chairperson. This is the highest ranking official at district level. The other core members of the DCC team include the primary healthcare supervisor, who is responsible for the supervision of the primary healthcare facilities and services in the district, and the nurse manager, who supervises the nursing, care, and patient services of the district hospital. Other core functions include the environmental officer, responsible for the environmental healthcare services in the district, the social worker, and the senior administrative officer, who is responsible for all the logistics needed for the operations of the healthcare facility. The administrative officer manages the transport, fleet of ambulances, catering, cleaning services, general logistics, and revenue collection. The DCC team members all head up divisions with teams of staff under them. The district hospitals are complemented by various health centers, which comprise approximately 10% of the ministry's district health facilities in Namibia. A health center is a healthy facility with larger and more specialized services than can be provided at a clinic. The staff complement is also upgraded when compared to clinics and can accommodate medical officers, commonly known to the general public as doctors. Clinics, on the other hand, provide basic primary health care services and are all run by nurses with no doctor. Every district has several clinics which compose of the majority of the ministry's healthcare facilities in Namibia, providing the largest geographical coverage. In order to effectively manage and coordinate all its healthcare facilities, services, and infrastructure, the Ministry of Health and Social Services has implemented a national referral policy. The referral system guidelines facilitate timely referral of patients from one level of healthcare to another and are therefore important for the public to understand and make effective use of when seeking treatment. To prevent the hospitals from becoming overwhelmed by patients, basic services for minor ailments can be sought by community members first at clinics or health centers, if available. Referrals can then be made to district hospitals for more serious cases. Patients with specific cases from district hospitals can be referred to the referral hospitals, where specialized services such as gynecology, oncology, pediatrics, and internal medicine can be provided. Referral hospitals exist because all of the district hospitals cannot be equipped with specialists and specialized services, although the ministry is continuously engaged with the upscaling of its hospitals. Namibia currently has 4 referral hospitals in Rundu, Oshakati, Katutura, and Windhoek Central Hospital. However, additional hospitals have been earmarked for upgrading to referral hospitals.
I would like to encourage the Namibian people that we have a health charter, patient health charter, that we have given to people at our facilities. Read the charter, understand your rights, because you have a right to be treated well. Not coming with an attitude and expect that the other person have to treat you well. It's a two-way drive. If they say it takes two to tangle. So you must come with a positive attitude and be received with a positive attitude. So read the charter. It's talking about the responsibilities and the rights of the patient. So does it also talk about the responsibility and the rights of the nurse, of a healthcare worker at that specific event.
The Ministry of Health and Social Services is a multi-faced institution responsible for a critical constitutional pillar of our society. We continue in our tireless endeavor to create an enabling environment to provide quality healthcare and social services for the attainment of our national policies and development plans, including Vision 2030 and the Harambee Prosperity Plan. Our leadership, management, and staff is fully committed to executing our constitutional mandate through rigorously focusing on the institution's vision, mission, and core value. This dedication and focus will ensure that the ministry will continue to provide integrated, affordable, accessible, quality healthcare and social services responsive to the needs of the population for this generation and the generations to come.